Well, good morning, everyone. Good morning. I am so excited that we are all here together to celebrate. We can't celebrate if you're still talking under the tent, though. Outstanding, outstanding. Again, I'm so excited that we are all together to celebrate the reopening of Wakebrook Behavioral Health Facility. I am Shanika Thomas, the Wake County Board of Commissioners Chair, and I have the honor of guiding today's event. Thank you all for being here today. But more importantly, thank you all for the hard work that you've done to get us here today. We have so many incredible partners here with us, and I know that you all have put in so much effort to make sure that Wake County is prepared to serve our residents when they experience mental health crisis. Next month, here on the Wakebrook campus, the Wake Recovery Response Center will open its doors to the Wake County community to resume crisis assessment and facility-based crisis services under the leadership of Recovery Innovations. Through our partnership with Recovery Innovations, formerly RI International, and Alliance Health, our residents will have access to this unique mental health urgent care. Experienced providers will be ready to help any adult going through a mental health crisis in a trauma-informed environment. In addition to getting the new team all set, the building received a little facelift for a more comfortable space and a thoughtful layout. And in that same vein, our other Wakebrook provider, WakeMed, will bring the building across the street online to provide inpatient care. And we'll hear more about these services in just a few minutes. This month, the Board of Commissioners adopted a new vision statement for Wake County. It's a way to solidify the values of all of our work. After a lot of thought, we agreed on what it should be: passionate, proactive, purposeful. The work happening here at Wakebrook is a perfect example of that vision. The massive increase in mental health concerns is a true public health crisis, right here in Wake County and across our nation. We have to be proactive in how we build up our continuum of care so that none of our neighbors fall through the cracks and suffer alone because they can't access care. Along with the new vision statement, we created new goals for Wake County. In the next 5 years, our goal is to increase the residents who have good access to healthcare and behavioral health services by 5%. In a county of 1.2 million people, that's a lot more people getting the help that they need. We are firmly committed to expanding access to treatment and dismantling stigma. So in this fiscal year alone, Wake County has invested more than $57 million in behavioral health. Next up, it's my pleasure to introduce to you a mental health care advocate and a care provider herself, our Health and Human Services Committee Chair, Commissioner Cheryl Stallings.
Thank you, Chair Thomas. And as she said, I am Commissioner Cheryl Stallings. It is an honor and a privilege to be with you this morning, and how excited we are for this new chapter in Wakebrook. As a mental health care professional, this is the type of facility and services that someone like me dreams of. A place where anyone experiencing a mental health crisis, no matter their background, their struggles, or their ability to pay, can find compassionate, capable providers who are ready to help. Even in the best of times, our healthcare system can be difficult to navigate. But if a person is also experiencing some very challenging symptoms, like struggling to communicate, or maybe their bodies or emotions are feeling very dysregulated, then seeking care can be daunting and overwhelming. A mental health crisis is not the time for barriers or bureaucracy. And that's to say nothing of the stigma and shame that still exists to some degree around mental health care that holds some people back from seeking help. That's why my fellow commissioners and I are so excited to partner with Recovery Innovations because of their no wrong door philosophy. Their emphasis on providing peer support from people who've been there before, is incredibly important. For you to be able to walk up to these doors and know that people on the other side are committed to understanding your needs, committed to finding your own path to healing, this can be life-changing. This behavioral urgent care facility will help hundreds of people, and that impact has the potential for even more positive impact towards client families and our larger community. It's never been more essential to have crisis assessment and crisis services as part of Wake County's continuum of care. We all know too well that thousands of people in our community are hurting as the national mental health crisis continues. I see it in my own therapy practice, I hear it from my colleagues, and we all see it on the news daily. The National Alliance on Mental Health reports that 1 in 5 American adults experience mental illness, and 1 in 20 experience severe mental illness. And we all know that mental health is not isolated from the rest of one's life. It's all intertwined. People diagnosed with a mental illness are much more likely to develop cardiovascular disease and substance use disorders, as well as have higher rates of unemployment and higher rates of homelessness. There are likely a number of factors that are driving the increase in mental health concerns. And I am so grateful that we will have a comprehensive toolkit of services to care for people with diverse needs at this facility. So thank you again to the folks at Recovery Innovations and Wake Med who have really stepped up for our community in this important moment in time. And thank you also to Alliance Health, who is Wake's dedicated and committed partner for behavioral health care. Next up, we're going to hear about the meaningful services that will be provided here. It is my pleasure to now introduce Recovery Innovations Chief Operating Officer, Joy Brunson Nsubuga.
Good morning, everyone. It is my pleasure to be here and to represent Recovery Innovations. It is our honor to bring services to Wake County. We have been in the behavioral health crisis space for over 30 years, but in North Carolina, we have been serving here for the last 15 years. We are excited for this partnership, the partnership with Alliance Health, with Wake County, and of course with Wake Med as well, to assist us in bringing these services to life. Recovery Innovations is known for our no wrong door approach, our recovery model that's underpinned by our clinical and medical expertise, and we are thrilled to be able to bring this to Wake County. As a Wake County resident myself, one of the things that we say at RI is that we want to provide services where we are comfortable with bringing our family members. And one of the things that is exciting now is that we get to bring these services to my family that also lives in Wake County, services that we know are well needed, services that when individuals come to us, they are not turned away, and we are there and ready to help. For RI, we talk about high touch, high engagement, meeting individuals where they are, and we do that with our recovery focus and our peer support specialists. Those individuals who have been there, maybe even through these doors before, and they are here to connect. Remembering that this is someone's worst day. We can talk about our partnerships today, all the things that we have done, but at the end of the day, it is about individuals who need our assistance. Individuals that we have the honor to walk beside in their recovery journey, whatever that means for them. And so today, it is really our honor at Recovery Innovations to say that we will have the pleasure of walking alongside our neighbors, our community, individuals who will have the opportunity, and we will provide that opportunity over and over and over again, no matter how many times they come to us, to ensure that they are supported on their recovery journey. This is exciting times in behavioral health. Not only is it 988 access, we have mobile teams, but also when you think of the SAMHSA National Best Guidelines, we think of someone to call, someone to come to you, and somewhere to go. And this will be the individual's somewhere to go. So we are excited to be a part of that overall crisis continuum for North Carolina. The next person that you will hear from will be Donald Ginsing, the president and CEO of WakeMed Health and Hospitals, to also talk about the services that will be here on the campus.
Man down, I had to go. Thank you very much. Thank you, Joy. Good morning.
Good morning.
This is a great and exceptional, beautiful day that we are here to celebrate what will be and continue to be a very transformative model of care for our community. Secretary Kinsley, God bless you and thank you for being here. Madam Chair, commissioners, elected officials, friends of elected officials, neighbors, anyone who showed up, thank you. Why is today so important? Because it really is a new beginning of a continued effort. And for WakeMed, we are deeply honored to be a part of it. Started by this community over 60 years ago when one of the largest deliverers of care to people of color in the Southeast couldn't sustain itself. This community said, not here. And so it started WakeMed, and we've grown from the little health system on the other side of town to the largest deliverer of care in the largest and best county in the nation. Thank you. This marks another step. We believe in partnering. This is the perfect example of that. How do we partner with the county? How do we partner with Alliance? How do we partner with RI? And how do we partner with our deep community and providers that are out there? What I'm most excited about is I think we are on a critical point of transitioning from mental health being the ignored, the forgotten, the marginalized, the suffering in silence, the we don't want to talk about it, that we have an opportunity to really be bold. And we're looking to be able to help with that transition. Mental health is health. Physical health is health. Spiritual health is health. And so we're very excited to be able to partner to open the 28-bed inpatient a little earlier than we'd expected. We're in the process of getting ready to build the first whole health campus in North Carolina, which, if you think about it, all right, you're going to have an acute care hospital, a mental health and well-being hospital at the same place. Not off somewhere, not hopefully ignored and forgotten, and we don't want it in my backyard. We're going to look because it's about taking care of the whole person. And so we're deeply honored to be able to support our community, support this incredible institution. We are super, super busy. We're in the mental health business. And if you don't think you are, you are. Right? As a provider, we're the 8th busiest emergency department in the country. And when people are sick, scared, vulnerable, they go to where people are going to be kind and care for them. And the more resources we have available when people are facing crisis, the more people are going to be willing to seek care and get the care that they need. And that care for all is fundamental to who we are as an organization. This will be the first nonprofit mental health beds in this community. And so that's, again, nothing wrong with the other model. It works. We have great partnerships there as well. But making that care for all piece is incredibly important. Lots happening. A lot's happening. We've been working on a variety of things to partner with community providers. We put together the Network for Advancing Behavioral Health with our incredible teams, bringing together so many wonderful providers in our community. Connected community to be able to help people with the social determinant challenges of transportation and food insecurity and access to medicines and those sorts of things. Population health, our Center for Community Health, taking care of our most vulnerable care and transitional care, our psychiatrists, our psychologists, our mental health counselors and nurses, and probably one of my most excited partnerships is with Shepherd Pratt. And if you never heard of Shepherd Pratt, it's because we don't talk about mental health. Right? You heard of Mayo Clinic? Heard of Cleveland Clinic? You heard of every other kind of clinic out there? They are the Mayo Clinic of mental health. And why haven't you heard of them? Because we don't talk about mental health. But they are the top mental health provider and have been in the country for 170 years. 170 years. And we are bringing one of the best in the world to this community. Why? Because this community deserves the best mental health and well-being care. And so we're very excited about partnering with Shepherd Pratt. And of course, recovery innovations around that crisis, right? So as we move into the mental health and well-being world, I look at this as a blessing, right? For WakeMed to be able to help, for WakeMed to be able to take this wonderful facility and come in and work with those in this community. I'd be remiss if I didn't thank our board of directors, which there's a reason a lot of people aren't in the mental health business is because there's not a lot of money in the mental health business. And sadly, that drives a lot. But what you see is our board and our team saying, as they did 60 plus years ago, not in my community. And so in less than 5 months, we stepped up, put something together, and we're going to offer this service again to this community. And I just know that besides being one of the best places to live, it's going to be one of the best places to get the whole person taken care of, their physical health, their mental health, and their spiritual health. And so God bless you all. God bless this facility and the providers. And more importantly, God bless the patients that are suffering and dealing with the challenges that all of us face. If everyone in this room doesn't know somebody or a family member, somebody they deeply love or somebody they don't love that has gone through some type of challenge, I'd be very, very surprised. And the boldness of what we're doing together, I think, is going to transform lives and reduce suffering for many, many, many years to come. So thank you for helping make all of this happen. And I'm now going to turn it over to David Hancock, our partner with Alliance Health. David? Thank you.
So I'm David Hancock, who was not smart enough to ask if this was an outdoor job. So I appreciate everybody's time and willingness to stand outside in the heat. So thank you very much. Thank you, Donald, for the remarks. Alliance is honored to have partnered with RI and WakeMed in the reopening of Wakebrook. We welcome the new Wakebrook and welcome you to take a tour. I'd like to acknowledge our special guests today. We appreciate their support. The important work creating accessible behavioral health for all is powered by the commitment and dedication of those who are here today. And we thank you for that. We are here to reopen a building, a process born from a September crisis of potential closure. It is not lost on me that a structure to serve as a community-based crisis center was itself reborn from its own crisis. It is critical to have this resource available to the community. Our partners are at the forefront to ensure that the right care occurs in the right setting that will optimize patient outcomes. This is mission critical. Breaking the cycle of emergency department visits, hospital stays, shelter stays, homelessness, and even the possible incarceration is a goal we all share. It is appropriate that we recognize the Herculean efforts of all those involved, the Alliance team, and particularly the committed partners of Wake County government. In September, the county jumped into action when services at Wakebrook were suspended. Wake County government has been and continues to remain steadfast in their commitment to behavioral health. This includes a commitment to care for our neighbors suffering mental health crisis. And we see this displayed every day at the Hope Center for Youth and Family Crisis in Fuquay-Varina. We see it in the school-based care teams within the public county system. And now this beautiful Wakebrook campus. Thank you to our great board of county commissioners, the county manager and the staff, and a special thank you, and she's hiding over there, to Denise Foreman and the county team that she supports. We value her partnership. I am proud to live in this county and be served by these dedicated leaders. Now, confronted with the closure of this facility, the initial priority was to ensure access to care. Specifically, where would people go if this facility was suspended for care? Almost immediately, provider agencies stepped up. They increased their capacity. They opened office hours. The team secured a care gap that didn't materialize, and that was for hard work and dedication. That's people stepping up. And we are grateful to those that met this challenge during our time of need. You've heard from our partners, RI and Wake Med, about their commitment to this project, to the well-being of the people in this community. These are impressive organizations, but neither were strangers to Alliance. RI successfully operates crisis facilities for Alliance in Durham and Cumberland County. Wake Med is known to all as a beacon of hope and healing for our residents. Together, RI, Wake Med, Alliance, Wake County have coordinated to deliver a beautiful renovation, and we hope you will take a tour. The success reopening of Wakebrook serves as a metaphor that those that seek care here for this building and the services provided were lost. With help, good people found a solution. And for those that will enter these doors, they will find good people poised to help. Stepping through those doors, patients will discover that they are valued, understood, and empowered. And may this facility ignite their passion for a journey to wellness. For our mission remains, provide essential care to those most in need. From September despair, the teams found solutions. They gave us hope. And with hope, great accomplishments can happen. Welcome to the new Wakebrook. And now it's my pleasure to introduce North Carolina Department of Health and Human Services Secretary Cody Kinsley. As we open this building, so does DHHS and Alliance begin a new phase. In just 2 months, we will become a tailored plan. And that takes a lot of effort, just like opening this building. I'd like to thank the Secretary, Jade Ludlum, and the DHHS team for their collaboration to make a tailored plan reality. While we're not having an opening ceremony for tailored plans, it is a milestone worth celebrating. So the launch of tailored plans are just around the corner. We'll put North Carolina at the forefront of national Medicaid care delivery. And it is with great honor that I turn the podium over to Secretary Kinsley.
Well, good morning, everyone. I will now deliver a 99-minute remarks on this beautiful July day. It is wonderful to be here, and I look around and I see all of my friends in one place at one time to celebrate such a momentous occasion here in my home county. Don't tell everyone. I want to first start by recognizing what my other speakers have recognized, which is it's hard to get to today. Cutting the ribbon, even though it's flying away, will be the easiest part of what we will have accomplished. But the really tense, long conversations, county leadership, Alliance, Wake Med, finding the right partner in recovery innovations to get here today is not easily done. And my promise to you is that it will get harder from here. Because behavioral health has been underserved and underprioritized in our communities forever. And unwinding that legacy is hard work ahead. Today is truly a day of celebration. We will see the opportunity of what can be done, because I believe, as I look around and know all of you, we can do hard things. Well, at least this row can do hard things. I'm not so sure about y'all. And it's been mentioned, and I completely agree, that behavioral health often is deprioritized because the money is rarely put into it to invest in it. And we are trying to change that, because my point to all of you is that we will pay for it whether we want to or not. We will pay for it in the 60% of people that are struggling with substance use disorder that end up in the local detention center. We will pay for it among those individuals who have chronic heart disease and diabetes, who cannot sustain their own treatment regimes because they are dealing with really complex mental illness challenges. We will pay for it as we try to tackle homelessness in our communities. We will pay for it in broken hearts and broken families, people who can't keep work and not being able to pay taxes. We are already paying for it. The challenge is, how do we find the money to invest upstream to transfer that system of care? Donald mentioned several clinics that are widely known, and I am confident, because of his leadership and the leadership of his team and what they want to bring to North Carolina, that one day, not too long from now, in a county far, far away, someone will say, "Have you heard of the Wake Med Clinic?" And they will, because he's pushing us forward with the help from Alliance and so many others to get it done. But getting the money to transform that is hard, and I have to start with a big thank you of making that possible. The biggest thing we could have possibly done for behavioral health evermore was finally expand Medicaid. Yeah. And while we started December 1 and we are almost to our 6-month mark, we have, as of this morning, enrolled over 430,000 people in Medicaid expansion, providing them with comprehensive coverage. And guess what, folks? When the adults are coming forward to enroll in expansion, we see that they're bringing their children with them. Children who were already eligible, but not getting enrolled because their parents couldn't have access themselves. And they now have access to a comprehensive health benefit provided by the amazing providers like folks at Wake Med and all through the county because of their participation in Medicaid. And thanks to our General Assembly, who never gave up and who pushed and pushed and pushed to deliver, we were also able to get $1.6 billion signing bonus to invest in healthcare. And our General Assembly, thank you again, put $835 million of that into behavioral health. And not 2 months later, we turned around and increased behavioral health rates in Medicaid for the first time in a decade. Because behavioral health will happen far beyond the bricks of this building. And it won't be one building in North Carolina that makes it possible. A month ago, we announced $15 million to stand up 9 additional behavioral health urgent cares across the state. Last week, we announced $22 million to do more facility-based crises all across the state. We have built on 988 to add a peer recovery line and a peer support line so that 24 hours a day, someone who's not in crisis, but just needs someone to talk to who has been in that place themselves, because guess what? When you're in a tough spot, probably talking to a person who's been there before is who you want to talk to. They can now call a peer warm line in North Carolina and have that person. Seating peer waiting rooms across the state, leaning into the clubhouse model, building an entire continuum of care. Because folks, as long as we keep behavioral health in a place of constant crisis, we will never get out of it. Moving to a place of true comprehensive care is what we have to do. And it can't be just one county, it's got to be the whole state. Wake County is leading the way. But your voices and your partnership and your push to deliver behavioral health for the people of North Carolina is the future I can see and the future that we will deliver, and it starts today. Thank you.
Thank you so much, Secretary Kinsley. We love our secretary. And thank you to all of our wonderful speakers. As someone whose personal motto is better together, it's so energizing to hear how these partnerships and collaboration make such a big impact. Next up is the moment we've all been waiting for, the official ribbon cutting. I'd like to invite all of the speakers to join me over at the ribbon. Grab some scissors on the table, but I also have a whole list of people who've helped make this happen. And so we'll ask that you join us for photos. My fellow commissioners who are here today, please join us. Commissioner Vicki Adamson, Commissioner Matt Calabria, Commissioner Don Mile, and of course, Commissioner Cheryl Stallings. Dr. Micah Krempaski, who's the Chief Medical Officer for WakeMed's Mental Health and Wellbeing. Rick Schrum, the Vice President and Chief Strategy Officer at WakeMed's Mental Health and Wellbeing and Innovations. Leisha Best, the Vice President of Clinical Operations at Recovery Innovations. And David Hancock, the Alliance Health Board Chair. If you could all gather for the ribbon cutting and some photos. And of course, I would never forget the members of our General Assembly. Representative Maria Servania, Sarah Crawford, James Robertson, Tim Longest, and of course, Councilor Corey Branch is here from the city of Raleigh. So if you all would, join me at the ribbon.
1, 2, 3.